All right, my latest passion, I'd like everyone to just smile for me. Yeah, it's not going to be the best, but it's going to be what we go with here. Good. So if you want to follow that, I'm going to put it up on Twitter right now so everyone can see what's going on in real time across General Electric. You can follow me at Mike Karsh at GE. Good. Thank you very much. Hey, I wanted to share with you a few things today around my background, and they said keep it a little personal, so I do want to keep it personal and give you some insight into myself, how I got here. I think how I got lucky in my career to have this, just a fantastic job. So I'm going to just start real simply. I'm going to admit I'm an engineer, okay? So I got that out of my system. And they let me out today, and I'm really happy to be here. But seriously, when I think back about they said, hey, keep it personal, tell a story, tell about yourself. So I thought about everything how I got here. And, I thought about it. I just liked electronic stuff since I was 5. I mean, I remember when I was a kid, blowing fuses up in the house, starting fires. My father was a radar guy in the Navy, so he had all this cool junk in the basement, and I would go down there and just kind of experiment and build stuff. I didn't know that I wasn't supposed to be able to do these kind of things. I didn't know that I didn't have the math background to do it, but I was able to make things and make it happen. And so that was kind of what got me going. The other piece that when I thought back of how I got here is he had a lot of darkroom stuff in the basement. And I used to go down there and I used to play with the chemistry and play in the darkroom and play with imaging. And so I was probably 8 and I'm really into photography. Now I couldn't afford anything. I mean, this expensive cameras, gosh, that was way beyond my reach. But I could go around the neighborhood and cut people's grass. And with that money, go buy stuff. Either electronic stuff, electronic books at the time, photography, darkroom equipment. And I really took this passion towards imaging and towards just, pictures and electronics. I would go out and just buy books on electronics and read these things when my friends were off doing crazy things, but I thought this was really cool stuff. And so that's kind of what I did. So I had one thing in mind. I was going to be in electronics and I was going to be an engineer. When I went through college, I came out and I really liked the math. But I tell you, it was on that early age I realized I probably had a problem, and I seen that later on too, is whenever I do something, I can't do anything just a little bit. So I wound up in grad school, and I really liked math, I liked physics, and the next thing I know, I'm in material science, and my first job while I'm still in grad school is designing semiconductors, because I loved quantum mechanics at the time. You know what? I didn't like the job, and I knew I needed to get back to something I really loved, and that was electronic stuff. So I kind of looked around, and after not even a year in the job, I found a lot of jobs back in the late 70s, and they were around electronic stuff. And I found 2 fields that fascinated me. The first one was, and it was big at the time, it was a lot of military and avionics type of job offers I had, from California to you name it. And then I found this job by pure coincidence, GE Medical Systems at the time. And so I interviewed at all these places, and I remember stepping back and thinking about it, and I said, let me see, I have a decision to make here. I can either design weapons delivery systems for bombs, or I can design electronic medical imaging equipment to help people. And it almost was like an easy call for me. I think I'm going to do these scanners. They look pretty cool. I thought at the time I would just kind of plug into GE. I don't know how you guys are when you take a job. And I figured I'd come into this job and I would kind of work on it for a few years and leave. So my goal was work there 2 to 3 years and get out. I want everyone to understand I've sort of missed that goal. I've been there 33 years, going on 34. But I got to tell you straight off, I feel like I just started yesterday. And that's really what turns me on. Now, I do know I have this problem. I can't do anything halfway. And so I just want to give you a little bit of my personal journey also as we kind of went through this, is, I pick up habits along the way. I get into these little modes of doing things. Well, the one I got in, somehow I picked up a habit of smoking cigarettes, which is, gosh, I just want everyone to know I haven't had a cigarette since July 18th, 1985 at midnight. It's been a long time. But again, I can't do anything a little bit. When I quit, I was up to 4 packs a day. I don't think I smoked them, but I certainly let them burn somehow. And so I kind of gave that up. But then I got into something else completely different that, again, I think helped me as an engineer. And people look at me and say, "You're an engineer?" I said, "Yeah, I'm really an engineer." "Well, you don't sound like an engineer. What does that mean?" "Because I don't have a pocket protector?" "No." "You're kind of an extrovert." And I said, "Well, I'm not an extrovert. I'm really an introvert." "No, you're not." So I picked up some other habits along the way. So I replaced smoking with other things that I found much more interesting. And I just wanted to show you a little bit of what I've done when I replaced one thing for another. I learned something about energy. There's free energy in this room. And I'm serious. You can just reach out like this and pick the energy out and put it in your hand, and it's gone. I don't know if you've seen that. You can pick it out like this, and it's gone. So what I did, I just can't help myself. I replaced one habit with another. So I really got into magic. And so I kind of became a magician, and I realized, you don't have to go to school to be a magician. You just have to say, "Hey, I'm a magician." And it's like everything else I've done in my career. Did someone say, "Hey, I give you permission to go do this"? Heck no, I just went and go do it. Did I know everything about what I was supposed to know when I went into it? No. When I think back about all the opportunities and jobs and assignments I've had over my career, I can't say I walked into these things and said, "I know exactly what I'm going to do and how I'm going to do it." Did the same thing with magic. I took up another habit, which I kind of took me until the last 4 years to kind of fix that one, is I like to eat. And if you had seen me 4 years ago, I had trouble with my passport getting back in. I was 104 pounds heavier. So again, in my normal way, I keep track of everything I eat. I can tell you how many milligrams of salt I ate yesterday, how many calories I had, what was protein, what was fat, what was carbs. I exercised, and the weight came right down. So I got myself in a good spot right now. But again, I tend to be intense. Now, when you put that all together, I had a chance to think about my career at GE Healthcare a little bit. And when I first came there, I started off designing nuclear cameras. And that was cool stuff. And I looked around, and I'm going, gosh, these guys are really cool. I walk in here, and I like photography. It was all analog, And I go in there, and they show me an image processing lab, and I see the CT scanner. Now, the disk pack on that, I think, might have been 20 megabytes. It was about the size of a refrigerator, of a top-load washing machine. It was massive. Today it would fit in my pocket on a piece of a thumb drive. But this is the kind of stuff we had, and they were processing digital images, and I'm going, how cool is this? There's only 2 places in the world doing this. It's probably the CIA and GE Medical Systems. So I'm going to come here and play with this stuff. So I came there, and I started designing nuclear cameras for a while, and I spent 9 years in X-ray, and really had a chance to take a look at how we transformed X-ray from standard X-ray to digital X-ray, and learned a lesson big time. I remember I was in the emergency room. We had this awesome digital X-ray machine, take pictures, right away, shows all kinds of amazing detail. I'm in an emergency room, and they bring someone in with a gunshot. They're looking for where the gunshot is in the descending aortic artery. They know there's a hole. They bring our digital system in. They do all these nice pictures. They find the problem. They shut off this nice computer digital imaging system, and they bring in a piece of film. I'm going, what is going on? And they go, well, you don't understand. The surgeons won't accept this digital image yet. They want a piece of film. Jeez. And, frankly, it's something that I continue to see, and as new generations of physicians come in, things change, and they've been changing quite a bit. And I'll show you some things on that. The other thing I learned is when we did some of these systems, I have letters from physicists, from physicians, some of the best minds you can think of about why some of these technologies won't work. I remember the first DSA paper, someone said, I had like 10 reasons why digital subtraction angiography will not work from the 70s. We go up to UW-Madison at the time where it was invented, and it works. So the physicists now come up with, well, I guess here's the 10 reasons why the approximations there sort of work are okay, and it does work. And I realized when you look at innovation, it doesn't happen within an individual discipline. It happens at the intersection of these different disciplines. So when I look at the physicists, I look at the engineers, I look at the clinicians and physicians. When we bring these disciplines together, that's how we drive innovation. I spent 11 years designing ultrasound machines, seeing the same thing there. People would back off and say, you know what? If you do the analysis, ultrasound imaging systems cannot work, and I'll show you what they look like today. And it's because the assumption are people are bags of water. Well, you know, I'm not a bag of water, a lot of water, but not a bag of water, and it's still images and images well. I've had a chance to, work in cardiographs and patient monitorings. I spent many years at MRI. I moved to our research labs in upstate New York, and I ran the imaging labs for a while, and then came back into this job in healthcare. I've had a chance to really touch a lot of this stuff. And I just kind of want to show you a few things. What I find fascinating in all this is what started off to me as just a simple nuclear imaging device. I mean, we're injecting antimatter into people. When you look at positron emission tomography, we come up with interesting molecules, we target molecular stuff, and through antimatter and the mutual annihilation of positrons and electrons, it's Star Trek, it's pure energy. I can figure out where that event happened by measuring time of flight of when the two photons arrive. I got an idea where it hits, and I make these gorgeous images. Again, I think back, and I guess I wanted to start with this. The future is certainly not what it used to be. I can't imagine coming up here when I look back in '78 when I started all this. I mean, that was what a supercomputer looked like. We had just basically figured out DNA structure. Today, I got medical images in the palm of my hand. I've got more computational processing capability in here, and I understand the human DNA genome. I look at some of the images that we get today. Hey, this is ultrasound, this is MRI. That's not a squeaky windshield wiper image anymore. That's a real nice image. I mean, that was a set of twins in 2006. That's what they look like today by using advanced signal processing and looking at same kind of things you see Pixar use in terms of how they generate images. MRI is gorgeous. It's just absolutely gorgeous, and it's intuitive. So that's what I see there. We've got cool stuff in the pipeline. We have things called carbon-13. I guess got to tell you what this is, because it's just cool. We're able to replace carbon-12, which is all over us, with carbon-13. And it has interesting properties. What that allows you to do is, now I want to just say this quite right, we can pre-polarize that. We can get it to light up in MR in ways that you never could imagine. So what we do is we cool it down to less than 1 degrees Kelvin. That's 1 degree from hell freezing over. Okay? When it's that cold, things really slow down. And then once we do that, we put it in a magnetic field of, several Tesla. So it's extremely magnetized at that point. Then we bombard it with microwave radiation for 45 minutes. When we pull it out of the deep freeze, we get it back into solution, we get it up to temperature of the body, we inject it, and we can watch that carbon-13 travel metabolically through your system. That's what this thing does. It lights up tremendously under MRI, and you've got 90 seconds, and it's all over. So that's what we're able to do. Cool stuff comes out of that. This is a prostate. On the left is what a normal image would be. You can see there's something there. But with carbon-13, it lights right up. And matter of fact, there's disease on the other side where we didn't even know it was there. So that's kind of some of the things that we can do. Now that is metabolic imaging. That takes us down another level from just anatomical imaging, so we can really see what's going on at that level. Now there's one other thing that just really excites me when I look at molecular imaging and molecular pathology. We're able to really understand what happens within an individual cell at a molecular level. We can see the molecular machinery within a cell on a single sample and multiplex that, which allows us to do this. Through automation, through bioinformatics, and looking at these different staining methods, we can build up that molecular profile, and that profile could either be okay or it could be the profile of a killer, and that's what we're trying to pull apart here by understanding what we see with these different molecular profiles. So that's what excites me about this job. I feel like I just started last week, and it's going on 34 years. Just a couple things I want to just leave everyone with. Speed is your friend, and vision is your friend. And what I've learned over the years is you put those two together. It's okay to fail often. Just fail small. Be curious, fail often, fail small. And the other one I learned, I'm a technologist. I love technology, but I have to partner with the business. I have to do things that are clinically relevant. The days are over where if you build it, they will come. This stuff has to be targeted. When I look at what does this do to medical cost, access of technology for people, and outcomes or quality, it has to be in that direction. You just have to keep it simple so people can understand it. It's okay. Everything can be analytical, but at the end of the day, just remember, common sense and intuition do count. Not everything is analytical. And I can't tell you how much I mean that. And I tell you, I got a piece of advice from a guy that had my job when I first came there. And he said, Mike, he says, it's really, really simple. He said, you can learn a lot from the folks you hire. The trick is just hire smarter people than yourself. And I tell you, I've taken advice over the years. I've learned a ton. The folks that we bring in, it helps me learn. I still have labs in my basement. I wanted to learn, so I write iPad and iPhone apps just for fun. And I have these kids that we bring in. I shouldn't say kids, but the folks that we bring in teach us, and I learn a lot from that. So that's what I want to leave you with and say thank you very much for taking the time today.